Today we're going to talk about Trail Guide Chapter 3, the forearm and the hand, and this is in the 6th edition of the Trail Guide. We'll start with an overview on page 108. So we have just the topographical view or the identifiable parts that when you get done with this chapter, you ought to be able to identify all of the things that are on page 108. So actually you're going to come back to this at the very end. Where I start each chapter and how I lay them out is we'll talk about the bones, we'll go to the bony landmarks, then we'll go to the structures that are on top of the bones, and then we'll talk about the muscles. So, I'm going to start with page 110, and what we're going to look at first is the information that's at the top, or all the areas that I have highlighted, and then I'll talk a little bit more about the specifics of the bones. First of all, make sure I have this centered on here good. So we're going to recognize that the humerus is the upper arm bone, but now we're going to talk about the thumb side radius and the pinky side ulna. So these are the joints that we're going to be defining, the humeral ulnar and the humeral radial joint. So it's where the humerus meets up with the radius and where the humerus meets up with the ulna, otherwise known as your elbow area. Okay, so that's first part that we're talking about here. You could then go forward and say at the other end of the ulna and the radius, or the distal end, which is going to be towards your wrist. We're going to have the next two joints that are coming up, so we're also going to define those at the distal end. So it's all the way down here on the bottom, but you can see it in your picture, the distal radial ulnar joint or the radiocarpal joint. So those are the two joints where the radius and the ulna end towards your wrist. So just defining all of the areas to start out with. The two bones, which are the radius and the ulna, I want you to notice that I have written, and I'll move this up so you can see it again in a little bit. The radius is going to be always on the thumb side, and the ulna is always going to be on the pinky side. We'll look at the difference between the ulna and the radius on the next page, and that will really help you cement all of this stuff in. After we have the radius and the ulna, we're going to come down to the wrist area. So this is the carpal joint, the carpal bones, which have joints within them. And here's the information that I need to make sure that you circle. We have 8 carpals, or when I'm rich, I'll have an 8-car garage, so that's how we remember that. And I'll be like, yes, I have an 8-car garage, so that's my 8 carpals. I have 5 metacarpals. This is the palm area of your hand. And then I have 14 phalanges. So these are your phalanges. So you do need to know you have 8 carpals, 5 metacarpals, including your thumb, and 14 phalanges. We will see that there is some differences in these phalanges and the thumb. Notice here where I have the thumb side, it's the pollicis, so it's your thumb. It has its own name. So we talked about the joints at the proximal end, and we have the joints at the distal end. Our 8 carpal, our 5 metacarpal, our 14 phalanges. All of this that I have here is all the way down to talking about how they're creating these joints. You do not have to memorize all of these, but I do want you to notice that there's just a difference between the distal and the proximal. And then here we have the difference between the mid-carpals. So it's really all this the terminology coming back into play. So this bottom box on the bottom is talking about the wrist joint or the radiocarpal joint, and then how it is formed in relationship to the ulna and the radius. So just go back and read that through because it is talking about the joints, the ellipsoid joints and things like that, which is going back into chapter 1, but we always want to be reviewing that information. We're going to look at page 111, but then we're going to actually skip one more page because it'll make a little bit more sense in the other pictures. What I want you to have on this, so don't focus on all this top part here, just another breakdown of the 5 metacarpals. We have the base, mid is the shaft, and then the head. Okay, so that's what they're showing here. And then you have your phalanges, so the same with your phalanges. You have a base, a shaft, and a head. So when somebody says they broke their wrist or they broke their finger, there's really a specific place that it occurred. It could be the base of the 5th phalange, or it could be the shaft of the 3rd metacarpal if they broke a bone in their hand. So all differences. And the same, even though we're not focusing on it in this picture, the same goes for the wrist. When people say they broke their wrist, I mean, there's 8 bones in there. So what happened in that dislocation or that break? Speaking of those 8 carpals, you do not need to memorize who touches who. In the workbook, they go through a lot of information about it, which is fine. I want you to do that as that potential extra credit for your chapter test, but you do not have to memorize that, you know, the hamate is right next to the capitate and all of that. I do want you to be familiar with the names of the 8 so that if you ever saw them in your future, you could think, oh, the lunate bone, where's that? Oh, that's one of those carpal bones. Again, the workbook goes through a lot of different ways to help you try to focus on which bone is next to which bone. Again, only for the purposes of extra credit. The state is not requiring you to know who touches who, but they could potentially ask you a question about one of the bones. So you do need to be aware of the names. So now we're going to look at the differences between the ulna and the radius. The radius is always on the thumb side. The ulna is always on the pinky side. The reason why I'm telling you that is it's extremely important for you to remember because the radius bone is rotating around the humerus. No, the radius is rotating around the ulna. Third lecture of the day. I probably should have maybe taken a little break. But so it is important to always remember because that radius bone is rotating, but it's always going to be on that thumb side. So when we just break down the difference visually, we can see that the radius bone is shorter than the longer ulna bone. I have to find out, this is our proximal end, this is our distal end, and I have that written at each end. I do want you to notice that the ulna is wider at the proximal end and narrower at the distal end. There is connective tissue in between here, interosseous membrane, and we'll talk about that when we get to the other structures at the end of the chapter. You will also notice that I have a couple things written here. So we have the trochlear notch, which I have as a large depression that fits in where the ulna fits into the humerus. So that is what is making up this lovely hinge joint here. If we look at the back of Mr. Skeleton, so we have where the humerus is and where the ulna fits right into there. So that's what we're talking about at that trochlear notch. And then we have the coronoid process, which is where the muscle brachialis, which is one of the muscles of this chapter, is also going to come into play. So keep in mind that wider and narrower. If we look at the bottom view, I have written that the olecranon process, which is this point right there, so that's down at this part here, that is where tricep brachii and anconeus are going to come into play, or those muscles. So it is at the pointy end of our elbow, that is our pointy end. Then we have the shaft of the radius and the ulna. These are long bones, that's that center part. And then we get down to where the brachioradialis is on the styloid process of the radius. We have the styloid process of the ulna. So on your wrist, when you look at it, you have bones that are more prominent. When you look at the surfaces of your wrist, that's these styloid processes. We'll go through those in a little bit, a little more. But just how all of this is where our 8 carpal bones are located. So we'll talk about on page 162 the interosseous membrane, which is between these 2 bones. But for now, just get used to where the head, the neck, or where the proximal end of these are, where the distal end of them are, and the differences between these 2. Again, always remember that radius is on the thumb side. The ulna is always going to be on the pinky side. We are going to move ahead in the book, so I'm not going to quite go through the chapter the same way that they have this laid out. Hang on, I got to find the right page. Yes, we're going to skip page 113 for that overview because I want to just move on to the bony landmarks and getting a few more specifics. So this is the top of page 114, that olecranon process and fossa being the pointy elbow. So it's just showing that right here in the picture. So it's located at the proximal end of the ulna and articulates with the distal humerus. I want you to highlight this because when you get done with these muscles, which there's not very many in this chapter, I want you to be able to look at that and know exactly what it's talking about. Right now it's a lot of terminology, but you need to be able to picture. If I said, what is located at the proximal end of the humerus and articulates with the distal humerus, you would say olecranon process, which is at the elbow area. Down towards the bottom, I have highlighted there about the epicondyles of the humerus. So those are the attachment sites for the tendons of the wrist and finger. So can you see here, look at your picture and see all these bumps? So now we're going to go back, and these are the bumps that are above where this area is, or if you look at these pictures here, can you see this is the ulna bone, here's our humerus, and look, there's those epicondyles. So if you were palpating this on your medial and lateral elbow area right now, you could feel those and know what they're identified as. So again, the epicondyles of the humerus. I also want you to notice at the very bottom of the page, we have the definitions for fossa, olecranon, and process. Those might help you with some of our bony landmark sites. On page 115, we have the supracondylar ridges of the humerus, which is just an identifying mark for us before we get to those condyles and epicondyles, but they're attachment sites for the forearm muscles. So we do have to remember that although this is the forearm and the wrist and the hand, fingers that we're talking about in this chapter, it does also involve the humerus, so our upper arm bone, because this area of the humerus is where some of our forearm muscles are going to be attaching. So we can't forget about any of our previous chapters when we go through this book. Again, on the bottom, condyle, epi, and lateral, in case you need those definitions. Those are always good little reminders of what's going on for us. Page 116, we have the shaft of the ulna, which, remember, I want you to think ulna being on the pinky side, so it is always going to be on that pinky side here. And it extends from the wrist all the way up to the elbow. The ulna is not a wrist bone, right? It stops before then, okay? So when we say shaft, it's the very center, but then we have that observation of that entire ulna bone. The head of the ulna is what is going to meet up at the wrist area or with those carpal bones. So when we look at that, we know that there is going to be a more superficial knob on the posterior medial side of your wrist. So if you look at the dorsal side of your wrist and your ulna bone, you can see there's always going to be a bigger knob there, right? So that just means that's where the end of your ulna bone is. See, you didn't even probably know that that's what that was called. Going on to the top of page 117, we're going to talk about the same thing but for the radius bone. We have the head of the radius bone, see a little magnified here. So it is where the radius's proximal end has a bell shape or a circle shape to it, and this is helping to stabilize the ligaments that are connecting the humerus and the radius. Okay, so it's a little harder to see, but if you look at that middle picture, this is right what we're talking about. So it would be at the proximal end of the radius is where the head of the radius is. And back in this paragraph, this is important because it is the pivot point for supination and pronation of the forearm. So again, this radius bone, this thumb bone, long, big bone, is rotating around the ulna for supination and pronation. Moving forward, I'm just going to briefly remind you that on page 119, here's all of the 8 carpal bones again. You need to know that there's 8. I want you to be aware of the names for the potential future, but I'm not going to ask you to break down who touches to, all of that. So just be familiar with those names. I am going to point this out in this area, talking about the carpal bones, but it's only the surfaces. It's the palmar, dorsal, radial, and ulnar sides. So hopefully that makes sense. This would be the palmar side, this would be the dorsal side, and then we have the radial side and the ulnar side. So we have 4 surfaces, or you can think of the 4 surfaces of the wrist area, which has a way to be touched or palpated. So from here, I am going to focus in on one particular thing that is for manual therapists, and more specifically, potentially just licensed massage therapists, because I know some of you are in those other classes for massage therapists. So I want you to look right in this area here, and then look at this on your hand. So this is the palmar view of the right hand. So look at your right hand. Identify the space that you can feel, and this is the pisiform and the hook of the hamate, which is a medial attachment for the flexor retinaculum connective tissue, which forms the roof of our carpal tunnel space. When we palpate the area, the hook is often tender. So this is just an FYI that this part of our palm we want to be aware of as manual therapists. Be aware of how you use it, because it could seem that it's extra tender. You don't have to remember any of this. It's not on the test, but I have a lot of peers that have been massage therapists for years, and they talk about they don't realize how much they use this bone right there and how much it ends up being even more tender and hurting. And the reason for that is because there is muscles that are attaching to it, and when we do flexion of our wrist, we are causing a little bit more unhappiness, or I call a little pissiness in that pisiform muscle. The other thing that I want to focus in on for the purpose of just understanding the carpal bones, so we have the lunate and the capitate bones, which I want you just, again, be familiar with the names. But when we flex the wrist, it slides the lunate to the dorsal surface. So if you look at where this massage therapist or this therapist, I don't know, has their hand, so a thumb is holding down one bone and the other thumb is on the end of our palm area. It is a good little stretch, right? But it is the most frequently dislocated carpal. I tell you that because if someone has said that they have broken their wrist in the past and we have no idea which one it is, you might not want to do a lovely stretch like that or potentially do this hand placement, whether it is a physical manifestation or a mental or emotional manifestation that can hurt in the future. So I'm pointing that out just for that purpose. Maybe just highlight it, come back to it later on when you're, mastered this book and you feel more confident with all of this information. So that is all that we're going to talk about for the bones. So now we're going to switch to the end of the chapter where we're going to talk about what lays on top of the bones or the other structures. So before we start adding on the muscles. Page 160 at the top is where we're going to begin. And what I want you to notice is the things that I have highlighted. So take a moment, highlight that, write these out, because I'm going to kind of open the book and we're going to look at two sides at each one, but I want you to have these things written down. Okay. Notice also at the bottom we have the definition of annular and collateral, which will help us because over the next page, or these 2 pages, we have a lot of information, but the pictures are here, but some of the definitions are here. So we're actually going to start with the radiocollateral ligament. So this is the ligament that is stretching from the lateral epicondyle of the humerus to the annular ligament and the lateral side of the ulna. So that is this right here. The radiocollateral ligament, it's holding ligament to ligament, is connecting bone to bone, so the humerus to the ulna. Okay? Then we're going to switch over to the annular ligament. So this is the ligament that is wrapping around the head of the radius. So it's stabilizing the proximal radius against the ulna when we do supination or hold a bowl of soup in our hand. So we're showing here the annular ligament, but also we have it in each of these views. So this is connecting the radius to the ulna. So you can see here, can you define those 2 bones? And the same here. The last one is the ulnar collateral ligament. So I bet you can guess that it connects to the ulna, right? So it is on the humerus's medial epicondyle. So remember our epicondyle of our humerus. And it's going to go to the coronoid process of the ulna and to the olecranon process. Remember the olecranon process is our bony point at the end. So this is deep to the common flexor tendon and the ulnar nerve. So a better picture is on this page. Ulnar collateral ligament connecting the humerus to the ulna. So imagine if the ulnar nerve is in this area, and then you have people that say they have some of that tingling sensation that is occurring at their elbow, or it occurs when they do a particular movement of their forearm. It definitely could be from this ligament. So the main thing is knowing what ligament is connecting what to what, and also having an understanding of how the humerus and the radius and the ulna are all being held together by these ligaments. Okay? I don't know why I said okay, because it's not like you guys can answer me. But anyway, on to the next page. 162 at the top. We just mentioned the ulnar nerve, also known as the funny bone. So we just talked about the ligament that is right there with it. So this is just showing basically where it's located. The olecranon bursa, by definition, you need to make sure you know what a bursa is, right? We talked about that way back in chapter 1. But you can see in the little picture here that they're just showing this little gel sac that is trying to help our pointy elbow have a little less tension in it. But also tricep is right there too. So just knowing that it's the distal tricep brachii tendon that is trying to help this little space have less prominence on our elbow. We also have olecranon bursitis, or just with any bursa, we can have a little inflammation or potentially an infection in it. At the very bottom, we have the interosseous membrane. So this is the connective tissue, strong fibrous sheet of connective tissue that holds these two bones together. We talked about this briefly when we were looking at the difference between the radius and the ulna. So this is what's in between my radius and my ulna. So we have our ulna, our radius, and our interosseous membrane. So it is stronger than the bones because it's the attachment site for the muscles in between these two bones. Not uncommon for the bones to fracture before the interosseous membrane does. So you might see that somebody has their radius or ulna bone sticking out, but this part would still be intact. I know it's not the best thing to think about, but that's how strong it is. Think of how many times we're doing pronation and supination in a day. A lot. So that membrane has to be extremely strong for our purposes for that. All right, this is a big one. So here, notice I have different colors, which have to do with what is all being identified. So you might want to pause this and just make sure you have all these things pointed out, because the explanation of carpal tunnel syndrome is also coming in with all of this. So first we'll start with the blue, the flexor retinaculum. Retinaculum at the bottom. So rope, band, it's to compress. So we can see we have flexor retinaculum here. They're also showing the tendons that are going underneath that this strap, band, rope is compressing and help holding in space. But then we also have flexor retinaculum up in this cut view of the wrist. So identifying exactly where that is on the very roof of the carpal tunnel. Carpal tunnel is just a space. Then we're going to go to this yellow here where it says the flexor retinaculum and the carpal bones form the carpal tunnel in which the flexor tendons and the median nerve pass. So again, carpal tunnel, here we have those tendons. Do you see all those little circles in there? Look like little things floating around in that carpal tunnel. So just that space. This palmar aponeurosis is on the next page visually, so we'll look at that on the next page. I want to go down to the other one, the extensor retinaculum. So this is also that retinaculum, so the halter, band, rope, it's compressing. So we have it on the flexor side, which would be the non-hairy side, and then we also are going to have it on the hairy side. So just those little different bands which are trying to help hold things together. I thought they had more of it. Oh yeah, here's the extensor retinaculum. So we have flexor and extensor retinaculum. Before we talk more about this, let's go to this pink spot. So the palmar aponeurosa. I want you to remember that an aponeurosa is a nerve or a tendon. It's a broad, flat tendon. Okay, so here we're talking about that is in the palm of our hand. So if you go over here, top of page 164, you can see the palmar aponeurosa. So just what that looks like. And typically this is like the lines that we might do some manual therapy with, but now we know why. So now I want to go back to this picture and look at the median nerve. And notice I have pages 442 and 101. So we need to take a little journey back in the book. We're going to go to page 42 to begin with, because this is where we're going to see an overview of the nerves in our body, so we can kind of trace that median nerve a little bit. So we've talked in the past about the brachial plexus. Notice the median nerve is part of that. So follow that. We're over to here about the axillary area. But then notice it goes up to my cervical area. So it extends from my neck down. The median nerve continues down, continues down. It's going to go into my hand all the way down. Okay? So we have that brief overview of just where it's coming out of our neck. Then I want you to turn to page 102. I'm sorry, 101. Apologize. We had this in the previous chapter, which is where we defined what carpal tunnel syndrome is, what some of the pathophysiology is, just some of the differences. So remembering again, this median nerve, which can cause things at our elbow, is coming out of our neck. So here's just another view of how we can have that compression or impingement that can happen within what people will call their carpal tunnel. So it is easier to see in your book, but I want you to notice the median nerve and where it's going. So the flexor tendons are in here. The flexor retinaculum is forming that roof, and so this whole space is very limited. Then we have the fascia that is on top of that, and so we can have a lot of tension in the palm of our hand. And this median nerve is what is going to give us that pins and needles compression sensation, but it's important for us to remember that it's starting at our neck and then extending down. So even though you might have somebody that is talking about, oh, I have carpal tunnel, my wrist hurts, or my fingers have some of the tingling, or I have no sensation here, there, or whatever, you have to trace this median nerve all the way back up, or in essence, start your work at the neck and then work down from there to get to the wrist area. Briefly, radial and ulnar arteries. So commonly this is where you would feel for a pulse. So just so you know that when you're in this area, you might be able to feel their heart rate on either side. Good news, page 165, for your visual pleasure, you can see where all these different ligaments are, but you don't have to memorize any of these. But you do have to know that there's a lot of ligaments holding our 8 carpal and metacarpal and phalanges together. The same with page 166. Again, just showing all of this, all of our ligaments that are holding things together, not muscles, just all those ligaments. Important for us to remember because ligaments are relatively avascular. They do not have as much blood flow. So we know that in the future, after an injury, there could be potential for that area to have limited range of motion, things like that. I'm going to look at an overview of the muscles. So this is page 127. I want you to highlight this for yourself so that you can understand the difference between abduction and adduction, because when it comes to the hand, we always have to talk about anatomic position. These that I've highlighted here are going to be easier for you to come back to after we talk about all of these muscles. So page 127 is one that I think you should come back to so that you can get used to where all of these muscles are. The same with page 128 and 129. So both of these are going to have views that are going to be on your chapter test. Not all of them, but some of them. And we are going to skip the actions and we'll wait until the actions for the very end, because that's always easier to talk about when we just get used to all of the muscles. So we're going to start on page 132. And we're going to look at brachioradialis. So even though it's the middle picture, I just want you to get an understanding of where brachioradialis is. It is above the elbow area, okay? Or, I'm sorry, brachialis. We have brachioradialis, that's the next one. Sorry about that. So brachialis is the one that is deep to the bicep. So if you look at this picture, you might think that it's bicep, except it's not. Bicep takes up your whole humerus. Now we're just talking about one that originates above the elbow and attaches below or onto the forearm bone. Origin, which you do not have to memorize, but distal half of the anterior surface of the humerus. So distal means lower, so it's the lower portion of my humerus, and it inserts into the tuberosity and coronary process of the ulna. So just remember, it goes from the humerus to the ulna, or it's right underneath what we think we're popping up our bicep, but it's really the muscle that's underneath, brachialis, that's making that happen. So it's the one that's popping it up. Strong elbow flexor that lies deep to the bicep brachii on the anterior arm. It is the one that helps the bicep bulge, so it makes it bigger. The lateral edge is sandwiched between the bicep and the tricep and is superficial. Right there. Notice the deltoid tuberosity, so when you find that, you know that brachialis is below that or inferior to that. I want you to write this down, but you don't have to focus in on it yet. I want you to write that it's an antagonist to anconeus inflection. We haven't talked about anconeus yet, but we'll get there. And then I also want you to write down that when we do the action of brachialis, which is flex my elbow, it is changing the fibers. It is actually shortening it, because when I do extension, I'm lengthening it. These are important things to remember when you're trying to do an assessment on a client and they're telling you, when I do this it hurts, or when I do this it hurts. It might be a particular muscle, or it could be the antagonist. So those are why they're important to write down for the future. Now we'll go on to brachioradialis. Sorry, I know I was mispronouncing those two in the beginning. Page 133. So now we have the muscle that is easiest to find this way. So if you make a fist, put your thumb on top, and then stick that thumb underneath the table and push up, it's going to pop up brachioradialis. If you take the name apart, you can tell it's on the radius side, so you know it's going to be on that thumb side. So it actually is the dividing line between the flexors and the extensors. These are your extensors. They're on the hairy side. Non-hairy side is the flexors. So I just remember I get extensions in my hair, hairy extensors. So that might help you with that. So this muscle is the dividing line between those two. Super important. It's the only muscle that runs the length of the forearm but does not cross the wrist, which means it does not have an action at my wrist because it stops. The carpal bones are my wrist, so this one is not going to do anything at my wrist. If we look at where it originates, it's coming from the proximal 2/3 of the rail supracondyle ridge of the humerus. So in other words, on my humerus down to here. So it runs the whole length of that forearm. If you can just remember that it goes from the humerus or the lateral humerus to the radius, that will help you. Okay? So it's not super important to know the exactness, but focus on lateral humerus to the radius, which it tells you it's the brachioradialis, so that's going to help you remember that it's on that thumb side, and that when we make that thumb or that fist, you can have that pop up. Yay! So we have brachialis and brachioradialis. On page 134, This is where it's telling us that brachioradialis is the one that is distinguishing between the flexors and the extensors. So now we're going to go to the hairy extensors. So this is page 135. It is important, don't skip down to the bottom yet. So I'm trying to purposely keep that off because the editor actually has an error in this book. So we have to make sure that when we look at the views, they're correct. All right, so here's what we've got. This is the hairy side extensors. And I want you to know that I put O, lateral humerus. That means they originate on the lateral side of the humerus. In anatomic position, lateral humerus. The other thing that I want you to notice is the breakdown. So I bet you can guess that the extensors of their wrist and fingers are going to do extension, but also just look at the commonalities in their name and take it apart. They all say extensor. Carpi means carpals or wrist. We have radialis ulnaris, and digitorum, digits, right? And then we have longus and brevis. Longest means long, brevis means short. So if you just look at the name, it will tell you what it does and where it's located. Extensor carpi radialis brevis is going to be on the radius side. Extensor carpi ulnaris is going to be on the ulna side. Extensor digitorum goes to my digits. And extensor carpi radialis longus is going to be longer, but also on my radial side. So easy to take them apart. On the bottom here, this is what I want to make sure that you see. So notice, according to the editor, so this is not just me saying this, but we did notice it, that this is showing the wrong muscle. It is not extensor carpi ulnaris, okay? So you have to just know that they put the wrong thing here. This is flexor carpi, not extensor. But it is on the pinky side. Here we have extensor carpi radialis longus. It's going to the first digit, right? To the base of the thumb and the first digit. Extensor carpi radialis brevis is going to the second digit. And then we have flexor carpi ulnaris, which is going to the pinky. Okay? On the next page, we have the last one, extensor digitorum, which is going to all of the digits. So here's where I have from the front page that they all originate on the lateral side of the humerus and they insert into the back of the hand. So if you can remember that the hairy side is your extensors, in anatomic position it's going from lateral humerus to the back of your hand. It's all this hairy side. Push this up. Because that picture was incorrect on the other side, this is correct. These words are correct, because that was a question. And I also think it would be helpful if you wrote down that in anatomic position, our thumb side is going to abduct or take my wrist away, and the pinky side is going to adduct or bring my pinky towards my body. Always referring back to that anatomic position. As far as these actions, we'll talk about that more at the very end. Now I just want you to know where the hairy extensors are located. For the benefit of having it make a little bit more sense, I want you to turn to page 140. And we're going to look at the flexors of the wrist and fingers. And we're going to break it down the same way we did the extensors. But this one has a little bit of a difference. So this is the non-hairy side. These are starting at the medial humerus in anatomic position. And they are going to go to the palm of my hand. One of these muscles doesn't say flexor in it. But if you are in anatomic position, and remember it's medial to the palm of my hand that will help you remember palmaris longus. The rest of them are all flexors. Then we have the carpi, which means my wrist, and my digits, which means my fingers. So easy to know where these are and what they do. These are the ones that are doing flexion of my wrist and fingers. So extensors, hairy side, they're doing extension. Flexors, non-hairy side, they're doing flexion. Again, the only one that's different is palmaris longus. But if you can remember that the palm of my hand is my flexor side, you will remember that he is the one that is different out of all of them. Most of the flexors originate as one mass from a common flexor tendon on the medial humerus. Also another way to remember where the flexors are located. Down at the bottom, we have that each digit or digitorum muscle has 4 thin tendons which pass through the carpal tunnel. We just got done talking about the carpal tunnel space. You can imagine it here. You can imagine it here. So these flexors are going through that carpal tunnel space. On the top of page 141, I give you a little breakdown, which is another way to remember where they are or what they're going to. Flexor carpi radialis is going to the first and second digit. Palmaris longus is going to the palm. Flexor carpi ulnaris, which is on the pinky side, look, it's going to the pinky, right? So it's actually super easy if you just take them apart, and especially compared to some of the other chapters, these muscles definitely make a lot more sense. They're easier to help with. Still keeping with the flexor digitorum superficialis, okay, going to the second and the fifth fingers, not the thumb. And then flexor digitorum profundus. Profundus means deep. So these are also going to the second to the fifth fingers. So superficialis and profundus are going to the same. One is just laying on top of the other. So as far as the flexors go, they're very easy to take apart. So we did the extensors and the flexors. So now we're going to go back to one that's kind of in between both of them. Page 139 for Anconius. It's a weak elbow extensor located lateral to the olecranon process. So olecranon process being the point of our elbow, and it's lateral to that in anatomic position. Okay? It is a triangle-shaped muscle, and it's very superficial. So it's a little hard to tell, but if you look at the point of your elbow and go lateral, but you have to be in anatomic position. So you can reach back, touch through pointy elbow, and go lateral, which would be out to here. That's where you're going to find Anconius. It is superficial, but you might not be able to actually tell it apart much in this area. Maybe. I mean, it depends, right? The other thing that I want you to write down is it is a synergist to tricep brachii. It's on the back of my arm, and it does the same action as tricep. Tricep starts with a T, it's on top, and conius is on the bottom. So I just remember that T and A, they're on the back side, and they are making extension of my elbow happen. It's a good way to remember it. The other one that's on page 139 is the way that I can point my finger as I've been doing. So a crucial muscle to assist in the digitorum, so specifically this index finger. What I want you to notice about this, so the name extensor indicus, it's going to extend my index finger, but look at how the origin and insertion are. No, you don't need to memorize this, but it is important for you to know. It goes from the ulna to the second metacarpal, which is this right here. So it's going from my pinky side ulna across my carpal bones and over to my index finger. So when I'm doing this, it's going from here, but it's going back over to the pinky side. The reason why I'm telling you that is sometimes people talk about they have particular pain in their finger, it's hard for them to point their finger. You have to know where this muscle lays for that. It goes across our hand or across the back of our hand. And you can see how sometimes it can be more prominent, especially with people that have this chronic situation of how they're holding their hand in that position, which now is becoming a lot more common because we're holding our phone a lot. So this muscle is going to be a little bit more prominent when it comes to that. Believe it or not, we only have a couple muscles left. This chapter is not a huge one. We are going to go to page 146, and we're going to look at pronator teres. And we are going to have another pronator muscle, so I'm going to kind of talk between the two of them, and then we'll switch some pages. First of all, we need to know that pronator teres is located on the surface of the forearm between brachioradialis and the flexor forearms. So if I remember that my flexor side is my non-hairy side, it's going to be up here. It begins with the T, it's on top. The other pronator muscle is pronator quadratus, which is going to be towards my wrist. So that's why, remember, teres is on top, will help you with that. The pronator teres is an antagonist to bicep brachii and supinator muscles because it's creating that pronation of the forearm. Pronator pronates, which is when I want to smack a bug, that's what I'm doing, or something. I want to slap my hand on the table, right? I'm doing pronation. So pronator teres is on top, and it is taking that radius bone and rotating it around the ulna. So teres is on top. The other pronator muscle is pronator quadratus. Quad means four, so it might help you to remember that it's going in this area and it has four parts to it. That's the quad. You could also remember teres is on top, quad is down here. It lies deep to the flexor tendons, and it does have nerves and blood vessels that are going through this area. It is not on the carpal bones because it has to take that radius bone and rotate it around the ulna when we do pronation. So it is originating at the ulna, inserts at the radius. The radius is the most movable part. So again, our quad, our four. So if we look at the two pronator muscles, we have pronator teres on top, pronator quadratus, which is towards my wrist, and both ends are going to take my radius bone and rotate it around my ulna. That's pronation. The opposite action is on the bottom of 147, or the supinator. This one is a little bit difficult muscle to palpate or to find. It is on the lateral side of the elbow, and it is creating supination, so it is an antagonist to pronator teres. But if you look at the close-up pictures on the bottom of 147, notice how it's really wrapped around these bones. So it's very hard to tell this muscle apart because of how it lays in there. If we turn the page to 148, we can see the exact origin and insertion in words and visually. But what I have underlined here might help. So it's the lateral epicondyle of the humerus. If you can't remember what an epicondyle is, it's the lateral humerus part, so we can tell that. But it also originates on the ulna. So notice where the O's are. So it has two different spots, and then it inserts into the radial shaft. So it's lateral ulna, also the humerus, but then it inserts into the radius. which is how it can create that supination effect. So maybe just picturing those things that I have underlined will help you remember where the supinator muscle is. And you can sort of kind of see where you might be able to feel it if you're shaking hands with somebody or you're rotating or pronating and supinating. You might be able to have an idea of where it is, but that doesn't mean that you're actually going to get down to the bottom of feeling it. So that was all of the muscles as an overview. Now I need to show you a couple things that you need to just take into account. Page 149. What I want you to look at is these two boxes. We have the muscles of the thumb, which the thumb is called the pollicis. We have 8 muscles in the thumb, 4 short and 4 long. I want you to know that. Then, if we move forward, on page 151, in case you couldn't see it in that box there, we have 4 long muscles of the thumb. Okay, just an overview. You need to know that we have 4. And then, magically, I bet you're going to guess that there's probably 4 short muscles of the thumb, which is on page 154. Okay, so 8 muscles in our thumb, 4 short, 4 long, but here's what you need to know about excuse me, the area that they're located. So this is on page 156, and we have the fleshy mound where these 8 muscles are located. This fleshy mound is called the thenar eminence. So we have this here. It's the thenar eminence, the fleshy mound that those 8 muscles are in. That you do need to know. And you might be wondering, well, I mean, I'm glad that I don't have to know these 8 muscles of the thumb, but I wonder why we don't have to focus in on them. Here's the easy stuff to remember about that. If I'm trying to find a good page to show you this. Okay, so if you turn back to page 149, and you can remember that pollicis is the thumb, and then we think, okay, but I have 8 short and 8 long. Look at the names. Adductor pollicis longus, abductor pollicis longus, flexor, extensor, flexor, adductor, opposition or oppens. So if you know that pollicis is your thumb, all these muscles tell you what they do. I bet abductor pollicis longus abducts my thumb. And I bet that flexor pollicis brevis flexes my thumb. So they tell you what they do. The state at this point at entry level is not requiring you to know exactly where every muscle of the thumb is located, but they do want you to know that there is 8. They want you to know the term for your thumb, and just that 4 short and that 4 long. The opposite, so we're going to jump ahead a smidgen, page 159. We're going to look at the fleshy mound that's on the pinky side. So we just talked about the fleshy mound on the thumb side, so now we're going to look at this fleshy mound on the pinky side. So first of all, we have the digiti minimi, otherwise known as your pinky. And here we have our fleshy mound. So there, it's on the ulnar side of the hand, and it is the hypothenar eminence, or the fleshy mound, where the digiti minimi muscles are located. Yes, you need to know that. These also have the same type of breakdown. Flexor digiti minimi brevis, I bet it flexes my pinky. Oppens digiti minimi, I bet it does opposition with my thumb. Abductor digiti minimi, so you get it. So you don't need to focus in on the muscles, but again, you do need to know that this is the hypothenar eminence, and you do need to know that this is the digiti minimi. So those things are important. but that's all you need to know about them. I'm going to back up one page and go to page 157. And I want you to look at the bottom, and we have the limbricals and the interosseous. Then when you look at the pictures at the top, you don't have to memorize these muscles. I want you to be aware of the names. If you were ever asked about where the limbricals are, they're the little feather ones that are inside here. The palmar interossi is in between the bones of the palm of my hand. So you need to know that information, but that's it. You don't need to know origin, insertion, or other things. On the bottom, we have the dorsal interossi. So we have the palm side and the dorsal side, which are helping to create all of those actions in our palm or in our hand. And then we ran out of muscles and areas to talk about. So the only other thing, yay, that we get to do is the breakdown of the actions. Don't get freaked out because it's actually super easy. So this is page 130. And first I want to look at the elbow, which is the humeral-ulnar, humeral-radial joint, right? Because the radius and the ulna both have to meet up with the humerus. Notice I have flexion 3, and then I've underlined all of these assisting. You don't have to focus on those. You do need to know that 3 that create flexion of my elbow area. And they all begin with a B. Bicep brachii, right? We're going to do a bicep curl. The muscle that is underneath bicep is brachialis. And then we have brachioradialis. So all of the B's make that happen. So just 3. You don't have to focus on the assisters. Extension is the T and A that I mentioned earlier. Extension is straightening my elbow, so the back of my arm is going to make that happen. Tricep and coneus, right? That's all we need to know. Then we're going to skip down to the forearm. So first of all, focus in on proximal and distal radial ulnar joints. So this is where the radius and the ulna come down in the forearm. Notice the 2 plus, the 2 plus. So the actions of the forearm: supination, or hold a bowl of soup in your hand; bicep brachii, he's the number 1 supinator primary mover; and then we have supinator, right? So just remember these 2. So when I hold a bowl of soup in my hand, I have bicep right here and supinator down here. So it makes sense. The opposite is pronation. We have the 2 pronators. Teres is on top, quadratus towards my wrist, so my 2 pronators. But then notice I have 2 plus on each. I have a little brachioradialis assister. Brachioradialis is that one muscle that separates our flexors and extensors, and it assists in both supination and pronation. Okay, so it's the little oddball. Otherwise, the 2 pronators are easy to think that they do pronation, and the 2 supinators, supinator and bicep. So just brachioradialis is the plus, or the little oddball in that, because it goes both ways. At the bottom of page 130, we have flexion and extension of our wrist. And if you haven't guessed, I bet the extensors do that and the flexors do that. So they say extensor in them, and they say flexor, with the exception of the palmar longus, or palmaris longus. So this is of the wrist or the radiocarpal joint. So flexion and extension of the wrist involves the ones that are going to the carpi and the digits. Okay. On the next page at the top, We have probably the two more hardest ones to think about, but if you remember that the radius is always going to be on the thumb side and the ulna is always going to be on the pinky side, then you can remember the radial deviation and the ulnar deviation. So we're still talking about the radiocarpal joint. So we have 4++ because the 4 extensors are going to do radial deviation, which is abduction. So I'm holding this up so you can see a little easier, modified anatomic position. I'm going to take my thumb away from my body. So that is abduction. So we have our 4 extensors. Because it's on our thumb side, we're going to add an abductor pollicis longus to that. And this little oddball flexor. So how can we have flexor carpi radialis that is going to do something to take my thumb away? So that's the only odd one of the group. So if anything, you can remember that the extensors are going to do that abduction or radial deviation, and then just add on the one flexor that's on the radial side. The opposite is ulnar deviation or adduction, or I'm going to add my pinky back into my body, and that is one flexor and one extensor. And you can see they're both on the carpi ulnaris side, and it just takes one of each to make that happen. As far as extension of the hand and fingers, it's the extensors or the flexors. Those are easy to think about. You don't even have to break those apart, right? Flexion of the 2nd through 5th fingers is done by the flexors, and extension of the 2nd through 5th fingers is done by the extensors. The only thing you have to remember about this bottom part is 2 things. First of all, do not forget that pollicis is the thumb. And remember opposition. It's when your thumb reaches towards your pinky or your ring finger technically, but that's that opposition. That movement is one that the state likes to ask you. They like to throw in little funky things. So not only is this opposition that occurs at your thumb and your pinky or ring finger, but also there is an action opposition, and the type of joint that this is the saddle joint, which only occurs at your thumb. So opposition occurs in the saddle joint, which is only at your thumb. Finished!